Hi, I'm Dr. Rena Azar, and this is Dr. Susan Raschal, and we are here today with Dr. Brainwaves, and we're going to talk about something that presents commonly to physicians. I don't care what kind of doctor you are. People come in and say, I think I have allergies for numerous reasons. So Dr. Raschal is going to review what happens when you go to see the allergist to investigate whether you do indeed have allergies.
There are some very important things that I would like to refresh your memory about before you actually come to the office itself. So when we do skin testing, we actually are scratching your skin several times with different devices. If you are taking antihistamines, such as Zyrtec, Allegra, Claritin, Xyzal, Benadryl, chlortrimeton, those medicines can mask the results of the test. So we recommend that you not take any of those medicines for 3 to 5 days before you even come in for your appointment. Instead of canceling your appointment, if you were continuing to take those medicines, come into the office, have the evaluation done, and then we can schedule a skin test even later. But at least we can get a consultation in and we can discuss some strategies and other tests that we may need to do for you. Other things that we would like you very much to bring in with you is a form of identification, which is going to be a driver's license, your insurance card. Those things will be important. Also, before the testing, in our office, we also offer an anesthetizing treatment. And what you do is you can bring in this medication that's called EMLA, EMLA, which is an anesthetizing cream that can go on one upper arm and on your back, wherever we're going to be doing the skin testing.
Very effective at making that area numb.
Exactly. The other thing about that is sometimes if a person is just coming in for a blood draw, we'll also tell them, especially in children, to put it in the bends of both of their arms because that's usually where we're going to draw the blood from. And that again will numb their skin.
That's right.
So therefore, it may not hurt as much. So that is also a great tool to use. We also encourage people, if they're going to be there for an extended period of time, because there's a certain amount of time we have to wait between the tests. So therefore, we're going to encourage you to bring in some healthy snacks, some allergy-friendly snacks. So peanut butter crackers in an allergist's office is probably not going to be the very best snack, just because we see a lot of people that have peanut allergy. Also, when you come in, be prepared to give a detailed history about the issue that is at hand. So we'll ask you several questions and try and identify what symptoms you're having, as well as what are some of the most troublesome symptoms, so that we can generate a differential diagnosis in our brain and then know what tests to order for you. And then before we even go to the test, we are going to do a physical exam. And we know that the physical exam can have lots of clues as to what might be going on with you. Here's an example of the Allergic Shiners. Allergic Shiners, as you can see, this little fellow, he's got these thick, unfortunately, he's got a lot of purplish coloration, discoloration underneath his eyes, and that can be associated with allergy in about 60% of cases. 40% of the time, it could be due to a sinus infection, or it can be due to genetics. And this diagram here shows you exactly the process ongoing with these allergic shiners. And it shows you the congestion that accumulates, and this is inside the nose. These are sinuses. This is going to be the frontal sinus, and this looks like the ethmoid sinuses, and this is the nose. And so all this tissue in here becomes engorged with blood, causing a lot of nasal congestion. And what you see is that nasal congestion then can pool underneath the eyes, and that's why you get these allergic shiners. We're also going to show you a picture of these Denny Lines, or Denny Morgan's lines. And these essentially are creases underneath the eyes. And this fellow doesn't have two. His are not as prominent as some that I've seen, but especially in children who have eczema or atopic dermatitis, they have these very well-defined lines underneath their eyes. And that is considered the allergic creases underneath the eyes. Another one is going to be allergic conjunctivitis, and if you've seen this, you will never forget it. And what happens is, this is supposed to be the conjunctiva here, and it becomes very, very swollen. It looks very gelatinous, so it almost looks like jello. And sometimes, in very severe cases, you may not be able to see their iris at all, because the conjunctiva is so swollen, it actually can block that iris. Here is hyperemia, which is when the tissue here is very, very swollen. The other thing we may look at is sometimes there can be these little bumps in there, which is papilla, which are these little bumps that accumulate because of allergy. And then this one is characteristic of what we call the allergic salute. And the allergic salute is this transverse crease across the bridge of the nose, and it usually is due to this or rubbing, and sometimes we call it the allergic salute because it looks like you are saluting someone. So that is the allergic salute. After that, after we do that physical examination, then we'll do skin testing. And there are two phases of skin testing. We'll do either prick or scratches is what they're called, and here would be an example of that. And we use this in our office. It's a duo pick, which is a device. I call it a blue toothpick that has a sharp end on it. And then what we'll do is scratch the skin with it multiple times. And we will put that in a little well. And in that well, we'll have the allergen or the thing that we're testing you for. And here is, if you can see these are now some positive results of the skin testing. So that would be phase one when we do the prick or the scratch test. And then the second phase of the test, and some people we have to do a second phase and others we don't, and food should never be done with this technique. This is an intradermal test. Intradermal meaning that it goes just a little bit underneath the skin, and you can see, oh, this is not the intradermal test. This is still a picture of some positive skin tests, because sometimes, depending on how many skin tests we're going to do, we'll do it on a person's back. And that's an example of some positive results on the back. And then here is when we are administering the allergen into the skin, and we use it with a syringe that goes slightly underneath the skin, and then we inject that allergen into the syringe, which goes underneath the skin. With each one of these methods, you wait 15 minutes to read the results, and that's why you may be in the office for an extended period of time. After that is complete, then all of that information is revealed, and we read it and then come up with a diagnosis. And we will identify what the best strategy will be for you, because this is really a custom design. And so we just don't put everybody at a cookie cutter. We actually individualize their care. For an example, if someone's coming in and they do not want to be on allergy shots, and we'll get that as soon as a person walks in the door, they'll say, I don't want to be on allergy shots. So for those people, we will talk about avoidant measures. We'll talk about medications. We will talk about the options. When it comes to a more permanent treatment, there are 3 types of permanent treatments that can be administered. One is the shots. Another one is drops. Drops are not approved by the FDA, so it's a cash option only. And then the third option, there are dissolving tablets that go under the tongue that can also be very helpful for people. So we will decide on that. We'll also decide whether or not you're a good candidate for the shots, the drops, the tablets, what have you. So there's lots of characteristics that we use to make a decision about what the best strategy is for you. So allergy is unfortunately a much more complex issue, because not everybody who is skin test positive should be on shots. In fact, 40% of people who have positive skin tests may not have the right symptoms that correspond to the things that showed up on their skin test. So those people may not be a good candidate for allergy shots. But be that as it may, allergy shots is the tried and true treatment, and more of a permanent treatment. And I should also mention that it's natural. And the reason why I say that is because we're giving you the very thing that you are allergic to. And we are giving you small amounts of it, increasing amounts, and we will start increasing the concentrations of those small amounts or small dosages over time, until we get you to the point where you are completely controlled. If you find that you're on shots for a year or two and we're not achieving the results that we hoped for, that's when we'll retest or we'll reevaluate and say, well, maybe you weren't the best candidate for this regimen. And so the key is to continue to reevaluate, and that's why we like to bring you back in. We want to make sure that you're using the medicines correctly. We're making sure that we are getting what we want for you is your best life. So we want to make sure that we are achieving not just my goals, but your goals as well. And that's going to be the key, and that's why the partnership is so incredibly important in any doctor's office as well as ours.
Yep. Thank you, Suze. It's nice coverage. Now you know what to expect when you go to an allergist to be evaluated, and you know how important it is to be individually treated and evaluated. Thank you.
Hashtag allergy.
Yes, ma'am.